is Chapter 11, Question 2. The tibialis anterior can be palpated the first muscle to the lateral side of the anterior tibial border, particularly palpable with fully active ankle dorsiflexion, most prominent tendon crossing the ankle anteromedially. And the extensor digitorum longus is the second muscle to the lateral side of the anterior tibial border, the upper lateral side of the tibia between the tibialis anterior medially and the fibula laterally, and it divides into four tendons just distal to the anterior ankle with active toe extension. The pronous fibularis longus is the upper lateral side of the tibia just distal to the fibular head and down to the immediately posterior to the lateral malalis, just posterior lateral from the tibialis anterior and extensor digitorum longus with active eversion. And the pronous fibularis brevis is the tendon of the muscle at the proximal end of the fifth metatarsal and just proximal and posterior to the lateral malalis, immediately deep anteriorly and posteriorly to the pronosis longus with active eversion. And the soleus is posteriorly under the gastrocnemius muscle on the medial and lateral side of the lower leg, particularly while prone with the knee flexed approximately 90 degrees and actively plantar flexing the ankle. And the gastrocnemius is the upper half of the posterior aspect of the lower leg, and the extensor hallucis longus is from the dorsal aspect of the great toe to just lateral to the tibialis, anteriorly and medially to the extensor digitorum longus to the anterior ankle joint. And the flexor digitorum longus is the tendon that may be palpated immediately posterior to the medialum malleus and tibialis posterior and immediately anterior to the flexor hallucis longus with flexion of the lesser toes while maintaining great toe extension, ankle dorsiflexion, and foot eversion. And the flexor hallucis longus is most posterior of three tendons immediately behind the medialis malleus and between the medial soleus and the tibia with active great toe flexion while maintaining extension of the four lesser toes, ankle dorsiflexion, and foot eversion. And the tibialis posterior is the tendon that may be palpated both proximally and distally immediately behind the medial malalis with inversion and plantar flexion and is better distinguished from the flexor digitorum longus and the flexor hallucis longus if the toes can be maintained in a slight extension.